Well, hello everyone. Welcome to the webinar. We're going to get started in just a moment here. So my name is Dr. Lewis Wolfel, and I am the founder of Next Gen Medicine. I will be your presenter today, and I have spent the last 17 years of my life dedicated to finding the most natural, advanced, and cutting-edge treatments to help people who are suffering from pain. And today, I'm excited to share with you information that can change your life. Before we get started here, let me just ask you a question. How many of you have ever thought that the only way you're going to get out of pain is to get a new body? I know that sounds funny, but many of you are thinking right now, you know what, that's true. The only way I'm going to be able to get out of pain is get a new body, but obviously that is not possible. But we're going to kind of come close. We're going to teach you some things and educate you on some different types of treatments today that will help get you towards that direction. All right, so imagine a life without pain. We want you to know your options. So today's webinar is on new solutions to pain. Before we get started, we want to talk about our purpose. Our purpose is to give you information to help you get out of pain quickly. We want to show you how to regain and revitalize your health. And we want to maximize your health potential for the rest of your lives. Sound good? Today's goals. We want to discuss the options that are typically used for pain. And we want to also discuss the options that are new and upcoming in medicine. We want to determine what option and solution is best for you. And we want to give you enough information to allow you to make the best decision to do something about your own health and give you an opportunity to do so. So who are we? Well, Next Gen Medicine is a network of doctors and other healthcare and fitness professionals that were brought together to provide advanced cutting-edge procedures combined with traditional medical and alternative treatments to allow patients to have access to more options when making decisions for their health. Our network consists of physicians, physical therapists, chiropractors, acupuncturists, massage therapists, and personal trainers. Having a team of multiple specialties allows you, the patient, to have access to the most comprehensive health care possible. Alone we can do so little, together we can do so much. It's a quote by Helen Keller. The main thing I want you to know today, and what everybody all wants to know, is understanding your options. You just want to know what these are. So we're going to discuss the common treatments given by your doctor. So let me ask you a question. Many of you, when you go into the doctor, what do they usually give you when you say you have some type of pain? What's the first thing that they tell you? Well, why don't you take some type of medication? Here's this prescription medication. Take this. If it doesn't get better, come back in 30 days. That's a standard, typical procedure in medicine, and that's just what they're taught to do. So you may have heard of some of these, like Flexeril, Norco, Vicodin. Now, if you don't get better in 30 days, what do they do next? They say, well, let's try something else, like physical therapy, chiropractic, acupuncture, massage. A lot of these therapies are relieving and they feel great and you get some results. Many people, with chiropractic, physical therapy, or acupuncture, or even massage, with all these types of modalities, they're good to go. They don't need to do anything else. However, it depends on their condition, what they have. Many people continue to come back over and over. They go through a treatment plan and they're like, well, I still have this pain, doctor. The arthritis is still giving me this discomfort. The therapy that I was doing was feeling, making me feel better, but it was only temporary. So then your doctor says, well, the next thing that we can do is something called cortisone. Now, many people have heard about cortisone. We're going to go into a little more detail about it later in the presentation. But cortisone is an anti-inflammatory. It's a very powerful one, and it's a steroid. And many people these days come into our clinics and they don't want cortisone because they know the side effects, because there's something called Google. And many people these days kind of get educated and look a lot of things up online. So they don't want to get this a lot of the times. Well, now you do cortisone and, well, your pain's still there. So, for example, if we're using like a knee, saying it's a knee problem, as an example here. There's something called a viscosupplementation, and this is only used for the knee. You may have heard of this Synvisc, hyaluronic acid, Suparts. Those are just some of the brand names, some of the common names that you've heard in viscosupplementations. They usually last about 6 months, so your insurance will cover them. And we do a lot of those, and they're very beneficial, and for people that are in pain because it lubricates the joint. It's I like to say it's WD-40 for the knee, and it works very well, but over a period of time it stops working, and so the patient's in pain and they're like, hey doc, this isn't working anymore. What can we do about this because it's my knee is not responding and it's not getting better. But viscosupplementation has been around a while. It is very beneficial, and it's something that we do in our clinics. Now, if this doesn't work, or for example, if it's the neck or the back and you've done cortisone and hey doc, this is still hurting me. What can we do next? I'm not feeling any better. Then they'll say something like, well, let's do pain injections. Has anybody heard of an epidural or nerve block? Yeah, they don't feel very good. A lot of times people do have a lot of pain from these after doing them. They're not comfortable, but then they'll get some relief from the injection, from the material that's injected, the substance that's injected, and they may feel good, but it's still 50-50. Some people don't feel better at all. Now, this is a place we're here to stop a little bit and say, well, why doesn't the pain go away if you inject something with some type of nerve block? Well, your body will respond differently to different materials, but it is smart. Think about this. It'll let you know if if it's okay to go away. If you still have pain in that area, your body is telling you, hey, you know what? It needs to do something to fix me. Body is very complex and smart. Now, if you do the pain injections and those don't work, well, what do you do next? Well, a lot of times the only thing you can do is they'll recommend some type of surgery. This could be back surgery, fusions. It could be a knee replacement or hip replacement, shoulder replacement, some type of orthoscopic, surgery where they scope and clean it out. So that's usually what's recommended. But as we all know, most people don't want surgery. So there has to be another option. And that's what people are looking for. About 8 years ago, I decided that my practice needed to find another option to medications and surgery. So we went to work. We started after surveying our patients. The questions they all had came to these simple things. What other options do I have to get me off of pain medications? And what can I try before having a surgery that is irreversible and permanent? Well, we did our homework. My medical team and I did our homework and research to find more conservative, less invasive, and more natural solutions. And we found them. So if you or a loved one have been diagnosed with a bone, joint, ligament, tendon, muscle, or nerve problem, today's information could actually change your life. We are going to introduce you today to a new field in healthcare called regenerative medicine. Regenerative medicine means, by definition, to bring into existence again. With regenerative medicine procedures, you would not only eliminate your pain, but repair, rebuild, and heal any injured area of your body. When I see this picture, I go over this slide, I always think of something when I was a child. I don't know, has anybody, when they were a child, ever try to catch lizards? Well, I remember a story when I was visiting my grandparents when I was a young boy. And in the desert, there's a lot of lizards. And I remember chasing the lizards and trying to catch them, and they would stop. And you step on their tail, and they take off, and the tail, they would, it would, it would disconnect from the body, and I would sit there looking at the tail moving around the ground, and I start crying and yell over, come over to my dad. I hurt the lizard, the tail, and it was funny at the time for my dad, but I was, a shocked little child. My dad said, "Don't worry, son. His tail will grow back." And as a kid, I just didn't understand that. Well, for example, if a lizard loses part of its tail, the tail grows back. That is what we mean by regeneration. Now, Of course, we're not at that level yet where we can grow limbs. And I say yet because we have no idea where regenerative medicine is going. But we're not there, but you get the idea that it can regenerate some type of tissue. And we do see a lot of that. We are not discussing how to feel better. We are discussing how to have your injured area actually regenerate. Our goal is to help you have as much regeneration as possible. In regenerative medicine, there's many different studies, research going on at leading universities and hospitals. You can see some of these like Stanford, Harvard, the Mayo Clinic. A lot of research going on these days, and it's very important because it is an amazing field, and it's changing a lot of lives.
You're looking at a few hundred cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your heart, joints, and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places: embryos, which are not generally used anymore, umbilical cord blood, or adult bone marrow.
So the type of stem cell will dictate how many different types of tissues can emerge out of it.
Scientists can engineer stem cells into the type of cells they want. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They're reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced to, say, those of a failing heart, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue the contraction pattern like a normal heart.
It becomes much more real when you have a personal connection to a disease or an illness where we don't currently have good options. And this is where people are asking more and more of the questions, what about stem cells?
The answer is researchers such as these at Mayo Clinic push forward to make regenerative medicine a reality for patients searching for successful treatment and perhaps cures.
Okay, so pretty powerful video, tells you a little about stem cells, and they were talking more about the heart. And in our webinar today, we're definitely discussing more things about orthopedic conditions, but I wanted you to get an understanding of that, because stem cells can help a lot of different diseases and problems. Regenerative medicine offers a way to eliminate degenerative disease related to pain, and that's what mostly we're discussing today. Degenerate means to become worse over time. Degenerative diseases are those health problems that will get worse without proper treatment. These include arthritis and most muscle, tendon, cartilage, nerve, and joint problems. So I'm going to talk a little bit about arthritis and the progression. Most people come into our office and aren't aware that there's different levels of arthritis. I'll ask them, well, you've been diagnosed with arthritis before, so what phase are you in? And they never can tell me. They just say I have arthritis, and it almost sounds like they have a death sentence, like when their doctor told them. They don't realize that there's different levels, and depending on the level that you're in, will depend on what type of outcome or result you can get with treatment. So this is a normal knee joint here. And if you can see this joint space, we're using the knee, and you can use any joint like the spine, but we're using the knee because it's easy to understand the anatomy of here. Right here is the joint space. You can see how thick that is, that dark space in here. Here's the bone, and here's the cartilage in the joint space. So that's a normal knee. You have a thick joint space there, nice and thick. Cartilage is healthy. The alignment is normal, so the way it's presented here is normal. No signs of degeneration. Now you go into phase one of degeneration. Now you can see how it changes. See how it's not thick anymore and it's even more narrow on this side here. This is actually the medial inside of your knee and this is on the outside. But you can see both sides are narrow. So that's phase one of degeneration. The cartilage softens. The cartilage loses its ability to absorb impact and is more easily damaged. And you can see that joint space loss. Now, phase two of degeneration, this is the most common, and this is where you're first diagnosed with arthritis. This is where doctors usually tell you have arthritis. A lot of times when they see a phase one, they don't mention it too much, even though that is a true phase of degeneration. They just don't want to worry you, so might not say that it's degeneration. But phase two is, especially in the spine, when you can see phase two, that's when they tell you have arthritis. All right, you can see how it's different here. There's no joint space really. It's very narrow. So you have large sections of cartilage may wear away completely with time. The joint begins to lose its normal shape. See how this is not lining up as good here? It's like changing shape. Joint begins to lose the normal shape and the cartilage breaks down inside. Now phase three of degeneration. Now you can really see how this is different. Doesn't look like the first one at all. This is also known as bone on bone. Many of you have heard of that before. Bony growths or spurs called osteophytes. See, that's what this is right here, how it kind of comes up in lips and spurs. That's an osteophyte on the edge of the bone of the joint. Open cysts may form in the bone near the joint, and bits of bone and cartilage may float around in the joint space, which you can't see here, but that's what happens, and you get that grinding sound, and it locks up a lot. So drugs could reduce your pain, but they do not stop degeneration. That's very important to remember. It does not stop, just masks the problem. As a result, people taking drugs for pain may continue to injure themselves even if they do not feel it. Right? When you're intoxicated with the drug, well, think about that. If you have that, then you're not really feeling anything. It's just like if somebody has ever had too much alcohol and was drunk, you bang yourself or hit your knee and you don't really feel it till the next day. So this is the same thing. If you're on a medication that's really neurologically changing that physiology and making you not feel the pain, then what's going to happen? You're going to keep doing the things you're doing, but it could be getting time. So you'll feel better today, but actually be worse tomorrow. In fact, non-steroidal anti-inflammatory drugs like Tylenol, Advil, Aleve, all those that you've heard about and buy over the counter may make you feel less pain, but over time they destroy your cartilage. And then you have the opioid drugs like oxycodone, okay? These things reduce pain. These substances reduce pain, but are addictive. And we know we have a problem in this country right now. It's a big topic when you hear on the news and politics. Well, opioid drugs now kill nearly 1,000 people each week, more than those killed by auto accidents. It's really sad. According to AARP, 1/3 of seniors have been prescribed a form of these addictive drugs. Now, be honest here. I'm going to ask you a question. If your car had an engine or check engine light go on, how many of you here would actually put a piece of tape over it so you wouldn't see it? There's always one. When I do these live lectures, there's always one person that raises their hand. But the truth is, you shouldn't do that, right? You should not mask the problem. You shouldn't put a piece of tape over anything and just ignore it. That's what we're saying here. You're trying to ignore something, because what happens if that actually occurs in your car and you see that engine light come on? Majority of people, almost everybody, would go to the mechanic to fix it. But when we have pain in our body, what we do is we tend to ignore it and say it's not that bad. I hear that all the time. I didn't go get it checked out because I thought it would go away. So we actually take care of our cars better than we take care of our bodies. So by putting that tape on over that light, that would be like taking a drug for a problem. You don't feel it, but it's still there. The other thing is cortisone shots we mentioned previously. Cortisone shots and pills are often prescribed. And as I said, many people understand the side effects of these. Studies have shown when taken for 4 months, cortisone can cause an 8% loss of bone. Think about that. Decrease your bone by 8% in just 4 months. That is one of the side effects. It actually decreases the bone density and weakens ligament and tissue. So if you get an injection into your knee, it actually will cause degeneration to occur faster. That's one of the side effects. So a lot of physicians now are trying to discourage patients from getting it unless they're in a lot of pain. And you try not to get multiple ones in a year. Taken for 1 year, research shows cortisone can cause cataracts and elevated blood sugar. So that's why if you're diabetic or you know someone that's diabetic, they're very cautious on doing any type of cortisone treatment for them because it can spike and elevate their blood sugar. So when drugs fail, the only alternative up until now has been surgery. All surgeries can have complications. We usually hear that's 50-50. I don't know about you, but that's not good odds. Today, we're going to provide you a solution to degenerative pain related problems that is safe and effective. You have two choices with any problem in life. You could keep doing the same thing over and over again with the same result, which is the definition of what? Insanity. Or you could try something new to resolve your problem. If we can show you today a way to get rid of your problems naturally and affordably, would you actually do it? Okay, let's now look at the solutions to the problems you have. Regenerative medicine and stem cells. It's the hottest medical topic of the decade. So, what are stem cells? Stem cells are known as the body's master cells because they are able to develop into all other cells. They actually become new cells. For the purpose of our webinar, we are discussing pain and orthopedic conditions. Stem cells have the ability to become new cartilage, ligaments, bone, muscle, and nerve tissue. For regeneration to occur, the body needs cells that have the ability to rebuild the injured area. In the body, these are called mesenchymal stem cells, so MSC. Perhaps a better name for the MSC cells would be messenger stem cells because they transmit a message to all the cells in your body to come and help restore and regenerate an injured area. The MSC messenger or mesenchymal stem cells bring an army of healthy cells to the area of need. Altogether, this powerful team of cells that heal you is called the matrix. So this matrix in your body helps you with reduction or elimination of pain, reducing inflammation, minimizing scar tissue, promoting soft tissue growth, and generating new bone, cartilage, muscle, ligament, or nerve growth. It's the elements of the matrix along with the MSC that helps your body repair or fix itself. Stem cells are also migratory. This means they will migrate or move to the area that is most in pain or injured. The problem is, as you get older, the number of MSCs can drop to 1 out of 400,000. Therefore, it will become more difficult to heal as you get older. As you look at this graph here as a newborn, you can see for every cell, 1 in 10,000 is a stem cell. But as you get older, like we mentioned, 1 in 400,000 when you hit age 50. And by the time in between here, you can see it's 1 in 1 million. But by the time you hit age 80, it's 1 in 2 million cells or stem cells. So you've decreased your stem cells in your body. That's why we age, and that's why we don't heal as quickly. And if you had a lot of trauma throughout your life, you're very active, you had accidents or contact sports, and hurt yourself a lot, even though you didn't think much of it because you healed, you're actually using up most of your stem cells during that time period. So as you get older, you'll find it harder to heal. Regenerative medical procedures can bring your body hundreds of thousands, if not millions, of MSCs and matrix cells to help your body heal naturally. The choice is to take drugs to reduce symptoms, do surgery if possible with all its side effects, or receive regenerative medical procedures and stop or eliminate the degeneration while also rebuilding and making new tissue in the area of need. There are different treatment options based on what would help you the most. Before we go into that, we want you to understand the different types of stem cells. Many of you have probably done some research and are confused. You've probably heard of different types of treatments. Now, different regenerative medicine is actually, it's good to have the different types because for each condition or the level you're in or what your problem is, you actually have a choice on different types of stem cell or regenerative medicine types of procedures. One of the types is the adult mature stem cells, which you get from bone marrow or adipose fat, okay, tissue. So the bone marrow, as you can see, they get this large needle and they go in, they harvest it from like your iliac crest or the pelvis bone right there. All right, it actually is painful. That's the most common thing we hear from patients is, there's residual pain from the donor site. They'll still feel it months after. And there's always a risk of infection because it's a more invasive, as we see here, more invasive type of procedure. So that is done. And the thing is the older you are, well, you're going to have less stem cells in there, as we showed you that graph earlier. So sometimes people have to do, 2 to 3 of this procedure to get the same result if they're doing one of the other types of regenerative medicine. So that's something to think about. People want to use their own cells. That is available, but it is more invasive, and there's more risk to it. I put adipose fat, the fat tissue here, in a different color. The reason why is as of 2017 November, the FDA kind of frowns upon using adipose for stem cells because it could be manipulated. There's a lot of regulation regarding stem cell therapy. When you're talking about stem cell therapy itself, the FDA, these are the ones that are more known as the gold standard. And so adipose though can be manipulated. So regulation they kind of frown upon using that. So most people should not. Most doctors have elected not to do it anymore, just to keep compliant with different regulations and laws. But there are still people doing it. But once again, if it's from your own fat, you may not be getting the numbers of stem cells. You're going to be getting hundreds to thousands instead of millions. So we're going to let you learn and teach you some of the other. All right. So there's another source which is embryonic or fetal tissue. That's what the controversy is. A lot of what people say, hey, we don't want to do stem cells because it's from baby parts. Just to let you know, that is illegal in the United States, so you can't do that here. And the research actually shows it's not as effective in many different types of conditions, and that's what people don't hear about. You'd think it would, it would be, but because of the type of stem cell it is, it actually doesn't get the same results as some of these other products or procedures. So this is one of the main ones that we do, and this is the umbilical cord, or we like to call immature stem cells, because they are adult stem cells, but they're immature because they're derived from the umbilical cord. So we also say it's non-invasive because there's no process, any type of surgical or procedure that needs to be harvested from yourself, because these umbilical cord tissue allograft cells are taken from a donor who is concerned with the welfare of others. These are healthy mothers that are pre-screened when chosen and have scheduled C-sections. And then what happens is certified harvest technicians transport the tissue immediately to a United States certified FDA-approved tissue laboratory, and then the tissue goes through rigorous testing and processed within 48 hours to produce a high-quality product that is safe and effective to be given to the public. So It's very it's if there's anything during the testing process that comes up positive, it's thrown out. So it does not get to to be able to be sold or and become a product to be able to give into the public unless all that testing, everything has been approved. So very little room for error there. Another type of regenerative medicine product you might have heard about is platelet-rich plasma. So that's where they actually draw your blood, your own blood, and we like to say PRP or platelet-rich plasma is the beginning stages, one of the first things that you can do in regenerative medicine at the lower levels. All right, you draw the blood, you put it in a centrifuge, you spin it down. What happens is it separates the red blood cells from the plasma. And you've got all these growth factors and great substances in that plasma to help heal. And then what you do, you see the yellowish substance, and then you inject it into like a knee joint or wherever that's going to be. And actually, it works best with the lower phase, like phase 1 and starting phase 2 of degeneration, tendonitis. So we've got a lot of elbows or plantar fasciitis, hamstrings, small muscle tears. That's what this really works well. And you hear about PRP being used a lot on athletes. And one of the main things that why it works so well is because PRP with that plasma and the growth factors and everything that you're injecting in that area, it recruits your body's own stem cells to the area. So when they talk, some people will talk about PRP as, oh, this is a stem cell procedure. It's not a stem cell procedure, but it recruits stem cells to your body, okay, to that area where you've injected. So it facilitates that process. Another one is something called amniofix. So amniofix, what is it? Well, amniofix is a bioactive tissue matrix allograft composed of dehydrated human amnion or chorion membrane that preserves and contains multiple extracellular matrix proteins, growth factors, cytokines, and other specialty proteins which are natural. Okay, so what does that mean in English? All right, so the amniotic sac, you have the membrane, the outer part of it. So they extract and take that material with the chorion that's actually covers the amniotic sac. So both of those, right, those layers have a lot of these growth factors. Because remember, that's nourishing the fetus, the baby. So when they're able to extract that and take that from a healthy mother, then they dehydrate it, and it's all natural because this is all natural in the human body, and they have the proteins and the growth factors in there that can help to provide regeneration. Now, cytokines, that word cytokines, think about this. If you had lumber and building material and you had all these workers at a construction site, well, you can just be sitting there and it would just stay there unless you had some foreman that told everybody what to do and told those workers what to do and where to go. That's what cytokines act as. They act as the foreman of the body, and they tell all these growth factors, proteins, and what to do and recruit the stem cells to the area. So that's very important to have. So what's important about amniofix is it actually recruits your own stem cells to the area as well. I like to say it's like a PRP on steroids, okay? So it just facilitates that process at a higher level. It reduces scar tissue formation, modulates inflammation, and enhances the healing process. So that way you can start to get that regenerative, properties and into the area, into the injured site. So this is always, so which option is best for me? Well, depending on the severity and your type of problem will determine which treatment and product is best for you. How many treatments do I need? That's a very common question. Well, bone marrow, if you elect to do that one, because remember, it's always your choice. We're going to go, we would talk to you about which one is best for you and your condition. However, it's always your choice. So if you chose bone marrow, it's an average 2 to 3 procedures. And once again, it's a more invasive procedure. And, the thing about that, as we discussed, it's, if you don't have as many, if you're older, then you don't have as many stem cells in your body. So that's why it would take an average 2 to 3. The umbilical cord tissue allografts, well, those type of products, those average just 1. And remember, those are young, immature cells. So you're getting, we know in those, you're going to get 1 to 3 million viable stem cells in those products. So those are usually the choice, and it's very easy, it's non-invasive, and very simple. There's no downtime. Amniofix also averages about 1. And then PRP is about 3. It's a lower, it's your blood. It's a very simple process, but it averages about 3. And like I said previously, that is one of the starts of regenerative medicine and that type of treatment. Now, how fast does it work? That's another question we always get. Well, it depends on many factors such as your age, level of degeneration, genetics, and overall health. I think everybody understands that's common sense. But most people report and feel relief immediately. Regeneration, this is something to remember too, regeneration continues 6 to 9 months after the treatment. And when going back to when most people feel relief immediately, those are people that are moderate, mild to moderate degeneration. But if you're more bone on bone, I've seen it over and over. People, the first 4 weeks will go by, and they'll say something like, I don't feel too much of a change, and then 6 weeks or 8 weeks go by, and they're like, oh, I'm starting to feel better. It's really difficult to get somebody to, when you're in pain, you do something like this, to be patient. Remember, if you're bone on bone, you have no cartilage. It's bone, so it's going to take a little longer to get enough space in there as it regenerates to be able to get the relief. Does that make sense? So think about that. And so you got to give it time to actually heal. Now, how long does it last after you get the treatment? That's a common question as well. And of course, I'd want to know that. That's very important to know. Well, if your body responds well to regenerative medicine, then if it regenerates new tissue, that new tissue is permanent and will last forever until you damage it again. If your problem is more complicated, for example, bone on bone, it may give you relief for 1 to 3 years. But I've seen many cases where people just get better because it all goes back to your genetics and how you heal and how you take care of your body. Those are factors that are very important. I mean, if you have certain disease, and if you have, like, for example, diabetes, people know, anybody with diabetes, it takes longer to heal. So that's going to slow down that process and may not give you the longer lasting results, but it still will do something. So this is what you have to remember. What options do you have, and you need to understand that. So we always want to be honest, sincere, and transparent in all of this. So, and this is something we would talk to you more about if we do see you. What is the success rate? That's another important question that everyone always asks. Well, we can only speak for what we have experienced in our clinics, and each patient's results will vary due to the severity of the problem, once again, such as age, weight, diet, genetics, overall health, and other complicating or contributing factors. However, we have experienced as high as 85% success in joint problems and slightly less in spinal problems. Surgery is 50-50. Remember that. Surgery is typically 50-50, and once done, it is permanent. When you have something done with regenerative medicine, you either regenerate and get the benefits of it, but it doesn't affect you, and it's something you always have the option to do the surgery later. If that's the case, you don't have a permanent problem. So many people want to always try that first because patients report that this is the most common sense approach to a last attempt before surgery, and that the chances of success and benefits outweigh any risks, which are very low. So the thing is if you have a permanent surgery and it doesn't go well, and there's surgeries that do, but you may have, and I've had great, success with some patients that have had to do a hip replacement or a knee replacement. But if it doesn't go well for you and you're that small percentage, or, in that 50%, I guess you would say, that didn't get well, then you're done. You can't do anything else. I have people that attend these webinars or go to our live seminars, and they've had the replacements, and I can't do anything, or anything for them because there's nothing we can do. They've already replaced the joint. So all we can look at is the other areas and keep those from getting worse. And that's a lot of times that's why they come in, because they don't want to do another one, because if it didn't work for them the first time, they don't want to do the other knee, for example. So it's always your choice. Remember that. It's always your choice to do what you want to do. So the next question we are asked is, what does it cost and does insurance cover it? Well, unfortunately, insurance does not cover stem cell related therapies, but it does cover examination and testing. Also remember, there are other treatments covered by your insurance that you may have not tried yet. Every time I talk to people on this and we actually discuss their problem with them, there's a whole list of, in the beginning when we talked about that list, there's many things that they haven't tried. So there could be things covered by insurance. But as far as regenerative medicine, the costs vary, but we never let money be a barrier to you getting some form of help. So we never let money get in the way, because we'll find a way to help you. Regenerative medicine's average cost is approximately $450 for PRP and up to $8,000 for more invasive treatment like a bone marrow procedure. Most people do not require the more expensive treatment, but it depends on your condition and just your choice. Remember, some people want to do their bone marrow and that's their choice, but once we educate them and we look at their condition, they don't have to do the more expensive one. So they're going to be somewhere, somewhere lower in the middle, but when they're talking about cost. Another question that people ask is, can cells from another person's body be injected into mine, or is there some process to match them? That's always a concern about for example, the umbilical cord tissue or the amnio-fixed product. Well, there's no need to match cells to your body if the option that is chosen is to use these foreign stem cell products, such as the umbilical cord tissue allografts. The process that they do to to create these products actually removes any blood from the product, which would be one of the main reasons that would cause a reaction if present. Additionally, due to high plasticity, there is a decreased risk of graft versus host disease. All of these and other questions you have will be answered after we evaluate your specific problem. Only when we know the extent of your problems and the causes will we be able to determine if we can help you and what would be involved. We would then work together to provide a program that would fit within your budget. So look at these examples of some people that got results. This is somebody that in 8 months, you can see this is the left knee, and this is what it looked like. So you can see the joint space so from the left to the right picture. All right, you see the difference there. All right, secret number one: why your doctor won't tell you the truth about regenerative medicine therapies. Well, the truth is that many doctors are so busy helping patients with so many different types of diseases that they don't have the time to learn about regenerative medicine. So they either refer out to a specialist, one of the clinics that we work with, or tell patients not to do it because they are not sure about what to say. I mean, that's pretty sad, but that's the truth. Is a doctor has, they some people will say they have a God complex, but in most cases, I think doctors want to take care of you and they're concerned about your well-being. So for more of the truth is they don't want to come off as they don't know something. So instead of saying, I don't know, many people will just say, don't do it. They don't say it's because I don't know about it. They just say, don't do it. And, it kind of discourages people, unfortunately. So you've probably learned in this webinar so far, you've probably know more about regenerative medicine than most of your primary doctors. They're getting more and more, information on it and learning more about it because their patients are coming back. So I've been a consultant for physicians for the last 5 years, so I understand what they're so busy, and that's why I understand this. And they really do want to help you. They just don't know how when it comes to regenerative medicine. So they are getting more wise to, and they're understanding it more. So that probably will change. But right now, if you went to your doctor and said something, they probably would make a comment, it doesn't work, or I'm not sure, I don't think you should do it. But when we talk to them, and we do call primary doctors all the time, your doctors, and we'll discuss with them, and a lot of times they'll agree and say, yeah, let's try this, because they know that you as the patient, you just want to try something, and you want to do something besides surgery. So once we educate your doctor on these types of procedures and what we're going to do and the success that we've had, they usually they usually agree and say, yeah, let's try it. What do we have to lose? It's there's no risk. So secret number two, well, regenerative medicine works best when the patient follows a good diet. I mean, it is important. And you don't have to get results, but we see the best results is when you have a certain low inflammation diet. That way, the product, the stem cells can do the best, and you have your body's in the best healing potential possible to get the best results. I mean, it's just common sense. I think everyone knows that. And when you combine other therapies after procedures while regeneration is taking place. So getting some physical therapy, doing massage, acupuncture is wonderful, chiropractic for alignment and keeping things moving. So all those different types of therapies while within that 6 to 9 months, if you're doing them, and we have other modalities as well uh, that we use to help regenerate and facilitate the stem cell process and different types of devices that we use and that our providers use. So it's very important because it gives you that time to do some things and get motion during that 6 to 9 months while the regeneration is taking place. And of course, having patience. Have patience and be positive. It's depending on your condition, as we mentioned before. You may need a little bit more time. So we've seen it over and over. I have to, when we started this in our office, I have to admit, like I was skeptical of a lot of things, and you'll see that with different doctors that get into regenerative medicine because that was the same thing in our office. The first 10 people that we did, I had to look at the numbers. I had to look at, is this going to work? And then what happened was, after time, and we let time go by, and we let people's bodies, the patient's bodies heal and give it at that time, we saw better results. We saw it did take some time, and depending on the condition that you're in. So, and you got to comply with the doctor's home care recommendations. It's very important. If there's any, it's very simple. There's not a lot, but if you do the things that we ask you to do, and then what will happen is you'll get better results. Secret number three is how to pay less for the best quality treatment. Well, Next Gen Medicine has a network of health and fitness professionals that have agreed to provide Beverly Hills level of service at Walmart prices. So the beauty about this is that because we work in a network and we are able to all work together and take care of our patients in the community, we're able to cut the cost compared to a lot of the other types of clinics in the area. I would like to now end by offering each of you the most precious gift I can. It is the chance to have a longer, happier, and healthier life as illustrated in this video.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
Wow, very powerful video. I look at the person on the left and see how healthy that person is and just enjoying life. And I see on the right, it is a very powerful video. Every time I see it, it actually, I'll tell you my story here. I personally have had regenerative medicine performed on my own knee that was arthritic due to an old ACL and meniscus surgery. Before doing the procedure, my knee would swell up and lock up at times if I was active. I am now able to run, be active, and enjoy full life with my wife that I was not able to do before. My wife is very active. She's actually a fitness instructor in fitness industry. So it was hard to keep up with her, and it was tough. But I'm able to do that now because I personally did regenerative medicine on my own knee. However, The main reason I am passionate to help others with regenerative medicine is that the video that you just watched reminds me of my own father. I lost my father 14 years ago to a pulmonary disease. The video reminds me of his last days. That person on the right, that's exactly how I saw him. It was the hardest thing I've ever gone through in my entire life. You can all think of someone you have known and loved that suffered and passed away. And it's not okay. I mean, I know it's part of life, but it's not okay to see that. And my purpose is to help people add years to their lives, quality of life, and resolve or reduce pain and suffering. Through regenerative medicine, we can now accomplish that. You know, I'm excited because we're handling orthopedic conditions, which affects many people, obviously, because you can't be active and you can't walk, and it gets worse, and it's tough to live that way. But I'm looking forward to the future and what we could do more with different diseases as we advance in regenerative medicine. So there is a lot of studies with pulmonary diseases and things like my dad passed away from. So I'm excited, to do something for that, and other types of conditions in the future, because this is it. This is regenerative medicine is the future, and it is the way to help people, and that's why it excites me. As a gift for attending today's webinar, we are offering you the opportunity to receive a comprehensive consultation, evaluation, and recommendations for only $20. So the catch to this is you must live in the Los Angeles South Bay area, because that's the clinics that you're going to go to. If you do not, and you happen to get this webinar sent to you and you're somewhere else in the country, just email me at info@nextgenmedicine.com, and I will try to find an area in someone in your area that will help you and do the same thing. We asked for the $20. It's very low, just because it shows that you will commit, and it's about the common copay that everybody pays, and because a lot of people will be coming with with Medicare, we want to make sure we're compliant with all laws, because Medicare, we're obviously not able to give anything for free, so that's why we don't do anything for free. So it is an amazing value. The time we spend with you normally costs $300 to $500. Think about it. We're going to spend an hour, if need more, with you, go over your case. Our purpose is to help as many people as possible, so we want to make it affordable to you. So this is really a no-brainer if you think about it. It's your time, and $20 to be able to get information. It's definitely worth more than that in our time, but we want to donate that time, a certain amount of appointments and slots to the public, and to be able to do that in our clinic, so we can educate you and give you the information you need for your problem. If you have any x-rays or MRI reports, please bring them with you if you have them. If not, we will discuss at your appointment if we need to get any. If you don't have them at the moment, and sometimes it takes you a while to get them, just come on in. We'll get a release, and we can always send out for them and help you with that process as well. But getting the information about your condition first is the most important. So take advantage of coming in and being able to do that. So to receive this gift, the only thing we ask is for you to schedule your appointment by clicking the link today, and come within the next week, since we only have a limited amount of slots for this webinar at that special offer. Obviously, we can't see a lot of people. We do have a business, we're running that, so we want to make sure that so a certain amount of people are able to come in with those slots. We're going to open up on different days as well, and different hours, to be able to accommodate some of the people that need to come in. Our purpose is to help you live a happier, pain-free life, so you can do those things you could do before you had the problems. I mean, it's important. So if you look at what you can't do now and what you were able to do 5, 10 years ago, it's important to get you closer to where you were back in the past, and regenerative medicine can help you with that. Remember, problems get worse over time. Unless you try something new, your problem will not go away on its own. You have nothing to lose, because we will not waste your time or money. If we cannot help you, we will refer you to someone who can. All we ask is for you to give us a chance to help you enjoy your life to the fullest. I mean, just speaking from my heart, as you know my story, I know it's not okay if you wake up in the morning and that first step, you're wondering, am I going to be fine today? Is it going to be a good or bad day? How much pain am I going to be in? That's not okay. You need to try to figure a way to stop that. You want to get up in the morning and feel excited and ready to attack life and enjoy life, to do the things that you want to do. If you are not going on vacations or not visiting your family, not playing with your kids or grandkids, not gardening, not doing dancing, not all the things that you used to be able to do when you weren't in pain, if you're not able to do that and you want a chance to do that, that's why you need to make this appointment and come in so we can see if we can help you. Nothing is guaranteed. We obviously know that. But if you can get the information, we know that knowledge is power. And if you can get the information that makes sense to you, and we can help you or give you, even improve the condition you're in now, then that would be worth the time to invest that time. Wouldn't you agree? Please click the link to schedule your appointment and take advantage of this special offer. It could change your life. One last thing is there's no risk. There's a no risk guarantee. What I mean by that, if you come in for your appointment and during your consultation you feel it is not worth your time, simply let us know. We will stop it short and will not charge you the $20. You can't beat that. So it's not about that $20, not about paying, it's about getting you the information. But if you feel that it's not worth your time, then you stop it short and we will not charge you. Okay? Because our main thing is to help you. Our main thing is to give you the information necessary to make the decision for your health. I wish everybody the best. Thank you so much for attending the webinar, and I look forward to meeting you in the clinic. Thank you very much.